I want to welcome everybody for a fantastic conversation, what promises to be a fantastic conversation with someone who is a very, very important part of the local Jewish community here in Greensboro, North Carolina, and very much connected up with Temple Emmanuel and with our Jewish family services. She is the congregational nurse for our area. This is Marlene Baruch. Marlene, how are you holding up these days?
Oh, okay. I'm holding up. I think that we're all working much harder now than we did prior to COVID, just like you and Rabbi Fred and the temple staff. Um, but it's okay. We're hanging in there and trying to do our very best for our clients.
Yeah,
We're
for those who've never heard of the congregational nurse, right, or the congregational nurse program, why don't you tell us a little bit about that? Where does it start? How, have you been doing this for a long time? What's that all about?
Well, I have been in this position for about 5.5 years. However, the Congregational Nurse Program, which is under the auspices of Cone Health, was started in 1998. And right now we have 70 or more congregational nurses in Guilford County and Rockingham County. And some are at churches. Um, so we have a nurse at the IRC. We have a nurse at the Salvation Army. So we're serving a broad spectrum of clients. And we have our meetings. Well, now we have Zoom meetings once a month. Prior to that, we were meeting in person, which was wonderful because we get to know each other and we always had an interesting program that applied to what we're doing. But we try to look at our client as a whole person, the body, the mind, and the spirit. We keep all of that in our mind as we are working and trying to help our clients. And our network is fabulous. If someone has a need, we can put it out in our newsletter, which comes out once a week, and it goes to everyone. And we help each other a lot. It's you always know you've got another colleague to call on who may know more about a certain topic than you do, or has dealt with something that you haven't dealt with. And so we help each other a lot in that way. So it's a great group. I love being a part of it. It's
Tell
very
me,
good.
without going into too many specifics, but tell me how you might, how your services might be used in the community. Let's talk for a moment, non-COVID times, pre-COVID times.
Mm,
How might
mm.
you work, with a person in the Jewish community, which is where where you're located through Jewish Family Services?
Right. Well, several ways. I make a lot of phone calls to clients. Of course, I'm continuing that. But in pre COVID, I made a lot of home visits. I made a lot of hospital visits and facility visits. And I accompanied clients to doctor appointments. Upon their request, I would go with them, sometimes just to have another set of ears to hear. I have sat with clients while a family member's having surgery. That is something I really am glad I could do because number one, you're supporting the person who's waiting because waiting is really hard in a circumstance like that. And then I have also been able to go in when the doctor or the surgeon comes out to speak with the family. I've been able to go in to listen to what he has to say. And that's really helpful. I always take notes because I know later they're going to say, what did he say about that? It's hard to remember everything and you're nervous and it's just a bad time. It's a bad time for you. And I have felt very free to ask questions during that time that things that I think maybe the client doesn't understand or maybe it hasn't been made clear for the surgeon to sort of expound on that. I think that's been helpful. I feel that it has, and I really am glad I've been able to do that.
I mean, you have been one of the points of light in our Jewish community for a long, long time. But now, especially since March, during this period, however we're going to label it, but during this time of pandemic, The nature of your work has taken on, well, it's taken on a very different turn. Can you talk a little bit about the nature of your work? You said before that we're all working harder, but I'm sure you wouldn't use these words, but others look to you and healthcare workers and say, the work that you're doing is essential. Some might even call it heroic. So talk a little
Mm.
bit about the nature of your work now.
Yes, well, certainly it's very, very different, and the need is a lot greater now due to the isolation the clients have from family, from friends, from social activities. And at the same time, I'm more restricted because I can't visit in the home or the facility or the hospital. And that makes it more difficult. So I talk to patients. I still call them patients. I'll always call them patients, but I guess they're really clients. That's the nurse in me. But I make lots and lots of phone calls, and that is such a positive thing because people really, really appreciate it, and it helps them to have somebody check in and to know I'm interested in them and I want to know how they're doing. And I also have increased my contact with family members. I've always contacted some family members, especially I have those who live out of town. And many times I would visit the parent and then I would text the daughter or the son, whoever, and say, I've had a nice visit with your parent and sort of bring them up to date. I'm doing more of that with families now because families can't come and visit either. So they're in a very difficult situation. So that has increased. Um, Trying to connect and engage, as I said, is challenging. One thing we have done in November, I had a virtual piano concert and a bagel brunch for the seniors, and it was on Zoom. I had 35 participants, and the concert was pre-recorded. A young pianist in Charlotte did the program for us, and he catered it just to our group, which was really nice. And then we provided a bagel brunch that was delivered to their door, thanks to some wonderful volunteers who, drove and delivered these brunches to the doors. That was a big success. And I think they really enjoyed it. In fact, we're planning to do another one for Valentine's. So just, trying to be imaginative and reach out to things that they would enjoy. Even if you just tune in for 30 minutes on Zoom, sometimes that can make a big difference. And it's something to look forward to also.
Yeah.
No, I was just going to say just how things have increased for Jewish Family Services. The need for therapy and case management has greatly increased during COVID. And our social worker, Janet Canode, has been quite busy with that. And she and I are currently sharing 2 or 3 clients that have needs that she can meet and also medical needs. So we're finding that that combination uh, is working really well in these cases. There are a couple of clients that we are able, when we have visited them together, when we could visit outside. I mean, it's getting a little too cold to do that. But when the November was so gorgeous, we could visit outside and have the clients sitting with a mask on, and we have our mask on, and we were able to get their children online on FaceTime so they could see their children, their 2 children and adult children. And that was so heartwarming, and to see the joy on their faces because they haven't seen these daughters in probably 9 months. So that was it was really sweet and heartwarming, and we did that more than once. So that was a wonderful, wonderful thing to do with them. Um, Also, our volunteer coordinator, Amanda Laughlin, is working with volunteers to make calls to check on people. Just a friendly call. We have several volunteers that are doing that, and if anyone's interested, they could certainly call our office number and leave a message for Amanda. if they would like to participate in that. And also, insecurity is really great in our area. And we have been blessed with a lot of food, a lot of donations, as you know, from Temple. We've gotten a lot of donations, and we've gotten, I don't know how many, but I know a number of checks that have come in just for food pantry. So we have quite a lot of food right now, and we are sharing that some, and we're working with other organizations to sort of collaborate the best way to get food where it needs to go in our city. We continue our food pantry. That has not stopped. That will not change. Every Thursday morning is the food pantry. But our numbers have slightly decreased. And we're not sure why. Some of the folks that are not coming now have been called and to let them know that we are open at our normal time. I think transportation may be a problem, or riding the bus during COVID may be a problem. We don't know for sure, but we are using some of our abundance to help others in the community, which is a good thing.
Yeah, I mean the work that you're doing and the work that others at Jewish Family Services, that's taking place is just so critical, as you've said. Um, let me ask you this question. What do you see? What are you hearing about what the next couple of months might have in store for us?
I don't know that we'll have a lot of change in the next couple of months. It'd be nice to think we'll be getting the vaccine early next year, maybe even near the end of this month. That seems almost like stretching it to me. Of course, that'll make a huge difference, but until we reach a certain level of vaccination, I think we'll still be um, obviously wearing masks for quite some time and following a lot of the same rules, so to speak, that we are now. I don't know that um, anything will change with visiting yet. And, in the next few months for me, I'm not expecting it to.
Yeah. Yeah. And if you had a message for those within the Jewish community in Greensboro, if you had a message for even the broader world at this time, in terms of COVID, in terms of things they're doing, what would it be?
Well, it would be to wear your mask, to wear a mask, everywhere you go. If you leave home, but stay home as much as you can. Stay home as much as you can, and use some of the time at home to reach out to others. You may think, there are people, we all have people that we're friends with and we haven't talked to in a long time, and it's a good time to call and check in and say how you're doing. Or a congregant, we miss each other. Congregation, we miss seeing each other at services. Even though we see each other on Zoom, it's not the same, but it's good, but it's not the same. And so, reach out, make some phone calls. We've been talking about that a lot. And we pick up in those calls things that you and Fred may need to know. That a certain person may need an extra call from one of you, maybe,
Yeah,
so forth.
that connecting point has been so important. I mean, we've said over and over
Mhm.
again, how we've all become each other's eyes and ears so that we can,
That's good.
help people that need help and connect up with others. And I'm just very grateful for the work that you do. Tell me a little bit about what your plans are for this Hanukkah. Maybe some of the things that you'll be doing personally in your own home, and you and Jean will be doing.
Well, they're limited too. It'll just be us, but of course we have our menorahs that we'll be lighting, and we'll be tuning in to the Hanukkah offerings via the temple. We're looking forward to that, and it'll just be us, but that's okay. That's just the way it has to be this year.
Yeah, exactly. This time of the year, I think back it was only a few years ago. Well, I was actually Thanksgiving from a few years ago that you became an adult bat mitzvah. And I was
Right.
wondering maybe if you would talk about that experience. You and Jean have been mainstays in our Torah study over the years. And I know that that's been a point of connection, not only for you, but for many others. But talk a little bit
Mhm.
about that process of becoming an adult bat mitzvah, Marlene.
Well, it was just amazing. It really was. It was so enjoyable. The classes with you and my classmates. I believe there were six of us, and we became very close as we studied together and we met every week together, and just so meaningful. And it was a nice accomplishment. I beginning thought, I don't know if I'll be able to do this. Man, I'm not sure if I can do this, but it was very, very good and meaningful. And I look back at some of the pictures that were made that day, or Gene made some pictures while we were rehearsing, or so on. He came and made some pictures. It's just, it's very heartwarming, and it just makes me feel so good. And it makes me know that was just the right thing for me to do. Totally. And I'm proud of having done that. And I look forward each year to the adults who are in the class and who have their B'nai Mitzvah. I love attending those. And we'll get back to that, I'm sure,
Yeah,
sometime.
I'm thinking
Maybe next
it,
year.
it was only supposed to be a couple of weeks ago that we would have had the adult B'nai Mitzvah. Of course, we've had to postpone. Some of that has
Oh,
been because while there have been things that have translated very well to to digital formats, preparation with adults for B'nai Mitzvah just wasn't one of those things, at least at this time. And so, we
yeah.
decided that we were going to postpone. Some of it had to do with the preparation, but I got to tell you, some of it also had to do with people saying, we really want to be on the Bima. We don't want to do it digitally or virtually. And, as we are looking at having youth do their B'nai Mitzvah, we're hearing from many families that they are going to, we are going to be doing this, but in a very, I would say, safe format, patterning
Mhm.
ourselves on what's happening in other Reform congregations. But the adult B'nai Mitzvah program will continue. It's just going to be, another year, at another time, and we're excited about that. Marlene, this has been a fascinating conversation. I don't know if there's anything else that you want to say to folks who've tuned in to be with us this evening. Uh,
Well, just I'm very appreciative that you asked me to speak. And I just want people to know that JFS is available if they have needs to give us a call. None of us are working in the office, but you can still reach us. If you leave a voicemail, I can get that. That comes to me on my computer. So that's really nice. And we just keep plugging along and trying to help people. And I'm enjoying what I'm doing very, very much. I said we're working hard, but I think we're accomplishing a lot. And just being there for our community is really important. It's always important, but it's more important, I think, right now during COVID. I think it's more important.
God bless you, Marlene. We are so grateful for your partnership and the way that you have been doing God's work in the world around us, and especially in the Jewish community. So, to you and to everyone, let's just say Chag Sameach, and we wish everyone
Mm.
very, very meaningful and light-filled Hanukkah.
Thank you so much. Thank you. Same to you and your family. Okay, thank you.